Hello and good morning, everybody, and welcome to the Center of Addiction and Faith. This is our monthly webinar and our Zoom discussion to follow. We're so grateful you're all here today. Our topic this month is addiction and BIPOC mental health. And we have some special guests here that will be introduced in just a bit, but we're really grateful they're here. For those of you that are here and have arrived, please click on the chat button. Tell us your name and the city or state you're from. That'd be great to get a sense from all of you from where you're coming from. My name is Pastor Ed Treat. I'm the founder and director of the Center of Addiction and Faith. And we're working hard to get faith communities engaged with the opioid and the addiction crisis that's plaguing our country right now. We believe that faith communities could play a huge role in helping to mitigate the problem. By addressing the problem, we could not only save a lot of young lives, but reduce crime, reduce homelessness, reduce incarceration rates, and so much more. Addiction is tied to almost every social issue that we face today. Just as we listen to the webinar today, if you have questions, please post them in the Q&A and they will stay in order that you post them. So your question will be answered in proper order. If you place those in the Q&A, we'll get to them later on in the discussion, in the webinar. Following this webinar, there will be a talkback session. It's at a different location. So when this webinar ends, you'll need to click on the new link, and that link is being posted in the chat page. So I encourage you to copy that and paste it somewhere so that you can access that meeting following this one. So please do that now if you can. It should be posted in the chat page, or will be shortly. With that, let's pause for a moment of silence to consider all those who suffer from addiction, especially those in the BIPOC community, and we'll follow that with the Serenity Prayer. God, grant us the serenity to accept the things we cannot change, the courage to change the things we can, and the wisdom to know the difference. Amen. Today, our host is Timothy McMahon King. He's the author of the powerful book, Addiction Nation. He is our webinar moderator today. Tim, thank you for bringing this issue to our attention. I'll turn it over to you.
Ed, thanks so much, and wonderful to be here with you all today. And I'm just thinking back to the fact that it was a few months into the pandemic that Ed and I first had a conversation, knew that the Center of Addiction and Faith was hosting these great conferences. At the same time, with the pandemic, there was lots of uncertainty, especially around in-person gatherings. And we knew one thing for certain, and that was going to be that with all of the lockdowns, with the disruptions, we were going to see a massive increase in people struggling with substance use disorders and issues with mental health, which was where this idea for these webinars first came from. And our first one was about that in particular, about how these shifts in how we relate and what our lives look like, the stress that involved, the disruptions to our schedules would significantly increase issues with substance use disorders, which sadly we've seen over the course of the pandemic. It's been about a 28% increase. That it was important to try to bring this information to folks who are working in this field, faith communities, to help keep them informed. So over the past few years, we've brought you lots of different topics. And I'm also excited today because Michele Butler is going to be one of the people who is carrying on these webinars along with the rest of the CAF team. And I am at this point stepping back and cycling off of the board, so you won't see me on these webinars for a little while. But if you do come to the Center of Addiction and Faith conference this fall, I will be excited to be there and to see all of you at that event as well. So right now, I want to take our time to introduce the folks who are leading our conversation today. And first, we have Michele Butler. She's originally from Central Florida, and Michele has been a lifelong learner and traveler for most of her life. In 2014, she received her MA in community counseling from Regis University in Denver, Colorado, with a focus on trauma and addiction studies. Michele brings here to the Center of Addiction and Faith over a decade of professional and personal experience with substance abuse and mental health fields. She has a wealth of diverse experiences with mental health and addiction fields in direct and indirect client care, program development, research, advocacy, and social justice. And Michele and I just got to spend some time together at the Wild Goose Festival, and she is as dynamic and to be someone who's leading in this field and thrilled to have her step in today and begin leading some of these conversations for us. And we also have with us Dr. Simoyan. And it's a great pleasure in the work that I get to do to meet lots of different folks. And when I first got an email from Dr. Simoyan, I was like, oh, great. She's in the field of addiction. I always love connecting with new people. And then I went to her website, and it is about the fact that she's the doctor and writer. And so saw that she had lots of books that were published. And then not just that, she's also a photographer and a musician. And so there's not a word that we use very rarely today, and that's polymath, for somebody who is talented in such a diverse array of fields, from the artistic expression to the scientific. And that is Dr. Simoyan. And in addition to that, she also has an impressive bio background, which I will only share a part of with you today. She's the medical director at New Directions Treatment Services in Pennsylvania, a full professor in the Department of Psychiatry at Drexel University College of Medicine. She also holds adjunct faculty positions at Penn State University College of Medicine and Geisinger Commonwealth School of Medicine. Prior to her current position, she was the founding medical and executive director of research at the Care and Treatment Centers and the program director for the Addiction Medicine Fellowship at Geisinger Marwood. She was also a founding faculty member at Geisinger Commonwealth School of Medicine. In addition to many awards for her great leadership, she has her combined interests in writing and photography in several books: Scranton, A Place to Call Home, The Amazing World of Butterflies, Living Foolproof, and a workbook for patients, Transformation and Recovery, Lessons from the Butterfly. Dr. Simoyan strongly believes in the need to transform education and healthcare with a focus on creativity, problem solving, and integration of the arts and sciences. So I'm going to pass it over from here. Dr. Simoyan and Michele Butler, take it away.
Wow, Tim, thank you so much for that introduction. And I know you're going to be greatly missed, but we appreciate you taking on the lead for all of these webinars. You've brought some great content to the community and to CAF. And I just want to plug in to the mobile app. If you don't have our mobile app, you can download it, and there you will find a history of all of our webinars so that you can see all the great work and legacy that Tim leaves behind. So we salute you and just thank God for you, Tim. And Dr. Simoyan and I have just had a beautiful time getting to know one another. I mean, she is a Renaissance woman, and Tim didn't even read half of her accomplishments. That would take the whole hour, needless to say. But besides that, you know, she graduated, you graduated college at 21, then you went to dental school. So, I mean, the list goes on. And I also, doing some research, Dr. Simoyan, found out that you were a daughter of a diplomat from Nigeria. So I want to hear a little bit about that. So we've got representation worldwide with Dr. Simoyan here. And our conversation is going to go in and out of the mental health crisis, substance use disorder crisis, and how that impacts the BIPOC community. July is National BIPOC Mental Health Awareness Month, and we know that the majority of substance users also suffer from co-occurring mental health disorder, as the research shows. And so, you know, unfortunately, we have to have a month designated, like a lot of different cultures, but I think every month is BIPOC Mental Health Month. Every month is everybody's Mental Health Awareness Month. So with that, Dr. Simoyan, I just want to thank you for being here and invite you to share anything that we missed that you find to be relative or relevant to our discussion today.
Thank you. Thank you so much, Michele and Tim, for that gracious introduction. Can you all hear me?
Yeah.
Yeah, okay, thank you. Yes. And so, yes, this is not about me, but because you mentioned me being the daughter of a diplomat. Yes, I was actually born in Washington, D.C. when my father was serving as a diplomat. I didn't grow up there at all. I grew up mostly in Nigeria, but we spent a lot of our early lives traveling in and out of Nigeria. And then I ended up returning to, I went to college at a very young age, and college for me was dental school. So straight out of high school, I went to university, and I finished high school at 15. And at 21. 6 years later, I was a dentist. And then I eventually came back to the US and went to Johns Hopkins to get a Master of Public Health degree from Hopkins. At that time, I was told that, if you had a public health degree from Hopkins, there was a job waiting for you afterwards. And that didn't quite pan out. But in my ambitions to save the world, I really wanted to get that public health degree from Hopkins. And my life took a different path. I didn't end up going to the WHO or UNICEF to save the world, but I ended up going to medical school and doing a lot more. But like I said, this is not about me. We're here to talk about mental health and addiction and the role of our churches and our faith communities. And why is it important? Well, we do have a mental health crisis going on, as well as an addiction crisis going on. And research has shown that many people would rather go to their pastor or their spiritual leader when they have a mental health crisis rather than going to a mental health professional. So it's really so important for us to engage our clergy, our spiritual leaders, and for them to have an understanding of these issues. Unfortunately, though, the church is really behind in addressing addiction and mental health issues. And I think what is at the root cause of this is because there's a lack of awareness and a lack of understanding. And to illustrate this, I'd like to share a story. So on the website of the National Alliance on Mental Illness, that's NAMI, there's a blog post I came across a while back. It was written by a woman named Ginger Robertson. And she shared how she had struggled with mental illness and how she had experienced discrimination from her church community. So she had been depressed from when she was very young. She had depression as a teenager. And when she went to the pastor basically prayed to cast out the demons. And that was his intervention. He prayed to cast out the demons and basically sent her on her merry way. And she writes about how she ended up going home and crying herself to sleep that night. There was nothing about, have you seen a psychiatrist? Have you seen a psychologist? Can we refer you to somebody? No. So she felt so bad. She felt like, she was such a terrible person that she allowed demons to get inside of her. And so obviously that wasn't helpful. It wasn't helpful at all. And as her life progressed, when she was older, she was still struggling with mental illness. She, at one point in time, was trying to get health insurance. So she was looking at Christian health insurance companies. And then what did she find out? Oh, we don't cover antidepressants. They're not biblical. Really? So I read that and I was like, oh my goodness, antidepressants aren't biblical. So are cars biblical? Are airplanes biblical? Are microwave ovens biblical? I mean, I think you can see where I'm going with that. But that was this woman's experience. And she, at one point when she was older, she actually even wanted to volunteer in a church youth group, thinking that she'd be able to help other people who were struggling with mental illness and talk about how her faith had helped her. And the pastor wouldn't allow her because she admitted that she had experienced suicidal ideations in the past. So she wasn't allowed to volunteer with the youth because of her own mental health history. And then eventually she was in a group and they had a meeting where a pastor said something about how depression wasn't real. And so she decided to start a conversation about mental health and mental health treatments. And then fortunately, several people in the group were honest enough to say that they had their own mental health struggles and they were on medication and the medication was actually helping. So she finally found a community where it was okay. It was okay. And to admit that they were that other believers had mental health issues and were taking medication and that the medication actually worked. So, but why did she have to go through all of that? Why did she have to go through all those experiences? And that's just one story. But I think it really highlights the importance of us educating making sure that our leaders, our spiritual leaders, are educated and that they really understand that mental illness is a disease. For some reason, it's like people are okay with you going to the cardiologist if you have a heart problem, or seeing the surgeon if you need surgery, and you often have the same people who don't believe that mental health actually needs treatment, or that it's just a spiritual problem. The same people would acknowledge that God heals through doctors, he heals through healthcare workers, but they act as if, the same God who's big enough to cure your cancer or to cure your heart disease through doctors somehow can't handle your mental illness. And there's something wrong with that. So I think we really need to understand that mental illness is a disease of the brain, and sometimes the brain gets sick and it needs to be treated. We have treatments that work. They don't always work 100%, but we do have treatments, and they sometimes involve medications. Often they do, but they don't always involve medications. And when it comes to addictions as well, addiction is a disease of the brain. For too long, it's been looked at as a moral failing, but we now understand that it's a disease of the brain. And yes, people who suffer from substance use disorders often make very bad choices, poor choices. Sometimes they do things that are illegal. But why are they doing these things? It's because their brain is sick, and we need to help them heal, help their brains to heal. And so that's kind of like an overview. I know we were also going to talk about what churches can do to address addiction and mental health issues within their communities. And there are a number of, I want to tell another story. Well, some of you are probably familiar with Rick Warren and his wife, Kay Warren. He was the former pastor of Saddleback Church. And they unfortunately lost their 27-year-old son to suicide. And this is somebody who was a committed Christian, good Christian family and everything, but he struggled with mental illness, and he eventually took his own life at 27, I believe it was. And of course, it was very, very tragic, very, very tragic for the family, and our hearts go out to them. But they basically are. The Kay Warren basically started a ministry where they provide support to people and families with who have mental health, who are dealing with mental health issues. So they've started this whole ministry, and I think it's important for us to think about how we can create safe spaces where people are okay, they're comfortable coming to ask for help. They don't feel stigmatized. I think that churches and church leaders and religious community leaders can also start by getting educated, making sure that they understand mental illness, they understand addiction, and that and some of the things that they can do to address these issues involve getting educated, but also collaborating with people in your community. So finding out what resources are available, and establishing collaborations so that when your community members, when your church members have mental health crises, you know who to refer them to, you know how to help them. And they don't, first of all, people shouldn't feel stigmatized. They should feel safe coming to ask for help. And yes, it's important to pray. I'm not saying people shouldn't pray, but very often people need they need professional intervention, and we have these resources available. So why not use them? The same God who gave us the knowledge to be able to treat and cure various forms of cancer, to treat diabetes, to treat hypertension, has also given us knowledge that helps us to address addictions and mental health disorders as well. So why not take advantage of them? There's also
so to your point.
Yes. Go on.
So to your point, Dr. Simoyan, thank you so much. And I have done a little bit of research too, because I feel like, why the disconnect? Why do you feel like the church is so slow to respond to mental health and addiction? And unfortunately, the African American church and Hispanic and the Native American churches as well are sometimes lagging more than other churches. So I just wanted to ask, like, why do you think that is?
Well, yeah, again, I think it's a lack of awareness, and thank you for bringing that up. When I mentioned earlier that a lot of people are more likely to go to their spiritual leaders first before seeking out a health professional, that's even more prominent in minority communities. So it tells us that
Yes,
it's even more
100%.
important. It's even more important for our leaders to be aware, to be equipped to deal with these issues. But I think that a lot of times they're not, and I think it comes from a lack of understanding. So people will say, "Oh, you're feeling depressed. You need to repent from your sin." And I'm not saying people shouldn't. I'm not saying people don't need to repent, but we need to understand it's a biological disease, and
Yeah,
it might not have anything to do with sin or unforgiveness or that sort of thing. There are even examples in the Bible where people were clearly depressed or anxious. They might not have had the same terminology that we use, but the fact that they didn't use
right,
the same terminology doesn't mean that it wasn't a mental health issue. We can talk about Elijah
right,
when he was running for his life. We can talk about Saul when he was being tormented by an evil spirit, and it took David's playing music on the harp to bring him healing, to bring him relief. We can talk about David himself.
right,
Several of the Psalms, he was clearly depressed and anxious. So just because they didn't call it mental illness necessarily doesn't mean that it wasn't mental illness. So
right.
and then nowadays that we have treatments that can be very helpful. Why not use them? Why not use them? I
So
think.
the research, yeah, the research that you said in the beginning about the majority of African Americans go to their faith leaders first. The research shows that nearly 80% of African Americans identify religion as important, and
Mhm.
that some of those leaders are first contacted by friends and family members. So sometimes instead of the person that needs the help reaching out to the pastor, either a family member or a loved one. And I did a little bit of research on why there may be a disconnect, and it seems that there is lack of information, lack of resources, not knowing how to contact different mental health professionals, as well as the stigma, which you talked about, and then as well as sometimes a distrust to different populations. We have to be really culturally cognizant when we deal with people of different backgrounds and faith. And so just having those resources available and
Exactly.
making those connections to those congregations is important. And that's
Mhm.
one of the things that Center of Addiction and Faith is hoping to do in the future, like providing those resources to the communities so that their parishioners can find the help. But for a long time, they've been sort of kind of marginalized in a lot of different aspects. But I think the mental health, like you talked about, in the African American community does have a lot of more shame attached, a lot more guilt attached. Why can't you just get over it? And there's a lot of historical and generational context behind that
Yeah.
as to why that is.
Mhm.
So I think definitely talking about it in this opportunity today with you and bringing light to that is going to allow people to see that there is stuff that we still need to do in order to increase awareness, but also to reduce stigma.
Exactly. Yeah.
Yeah,
And speaking of reducing stigma, some of the things that we talk about in terms of reducing stigma are like addressing the way the terminology that we use.
exactly. The wording.
So when we talk about addiction, for example, we don't refer to people as addicts or junkies, or I mean, a lot of people still use
Right.
those terminologies, but they're people. So we're encouraged to use person-centered language. So it's a person with a disease,
Exactly.
a person with a substance use disorder, not an addict,
Mhm.
not um, and then even alcoholic. We hear that a lot. So rather
Yeah.
than saying somebody's an alcoholic, they're a person with an alcohol use disorder. So it's a person with a problem, not right. So we shouldn't focus on the behaviors. We should focus on the fact that they're people, and
Sure.
understand that these are people with problems, people with illnesses that can be treated. You know,
Right.
the brain is an organ, just like the kidney, just like the lungs, you know, and it can get sick. And when it gets sick, we need to help it heal. We need to help the people heal. And also, you know, when it comes to things like saying somebody committed suicide, uh, we try to avoid using that terminology because it's like saying they committed a crime, you know. So if somebody takes their own life, you know, it's preferable to say that they died by suicide, they completed a suicide, um, but not that they committed a suicide, because that's really, again,
Right.
making it sound like they've basically committed a crime,
Right.
um, when in
Yeah. Pathologizing of different terms
exactly,
can turn
exactly,
people off when they're trying to
exactly.
reach out because they don't want to be perceived as, you know, those
Mhm.
negative stereotypes that they're known to be in certain cultures.
Exactly, exactly. And like the story I mentioned earlier, the woman Ginger Robertson, she wanted to volunteer in a youth group and was actually hoping
Yeah.
that she could help people by sharing her experiences. And then because she had a history of suicidal ideations, it was like, okay, no, thank you, we don't want. Yeah, can you
Yeah.
imagine that? Can
Yeah,
you?
it's hard to believe, but it happens quite a bit. You know, like
Mhm.
you said, we have a disease, or the person struggling has a disease. It's not a moral failing. Um,
Exactly.
you know, some of the most spiritual people I know are in the rooms of Alcoholics Anonymous and Narcotics Anonymous and struggle with severe mental illness. So it's definitely a disconnect.
Yes.
Side of things, you know, a lot of times people from different cultures um, are more diagnosed more often with severe mental illnesses. For instance, African Americans are 4 times more likely to be diagnosed with schizophrenia, and then Hispanics are 3 times as 3 times likely to get diagnosed with schizophrenia than European Americans. So there's also um, a lot that we need to incorporate into the medical community
Mhm.
and the mental health community in terms of cultural awareness and competencies,
Mhm. Mhm.
because when we diagnose people with different severe medical diagnoses, these follow them, so that,
Exactly.
you know, when they do go look for a job or apply for insurance, they have these labels attached to them that
Mhm.
very often are misdiagnosed. So that's also an issue that mental health practitioners need to challenge themselves about with working with disparities in different communities.
Oh yeah. Thank you for so much for mentioning that. I mean, the labels really do follow people,
Yeah.
and there are
Well,
times when
well,
yes, go.
yeah. Well, I would just wanted to give a little quick story. I did my internship in
Mhm.
Colorado Springs at a psychiatric hospital. So this
Okay.
is about cultural competence, cultural competency. So one young woman, she was African American, was diagnosed with schizophrenia because the therapist acknowledged her doing this, right? And was thought, okay, that surely is a tick or something. Well, come to find out, she had hair extensions. And if you know anything about hair extensions, they get itchy. So when you're hitting your head like that, it's not because you're hearing voices or have ticks, it's because you need something done to your hair. So that was pretty telling for me to see that and explain to her, no, I think she's just got to go to the hair salon. But those are just some of the things we have to realize in terms of being
Oh
culturally competent, and pastors especially, you know, in terms of spiritualizing everything.
yeah,
We need to know a
exactly.
little bit more about people's backgrounds, and, you know,
Mhm.
like the Native American community as
Mm.
well. You know, they believe in a lot of different belief systems culturally than Euro or Anglican society. And so when I was working at the same hospital and they were talking about seeing visions and having experiences outside of their body, well, that's part of the Native American culture
Mhm. Mhm.
and
Mhm.
their practice. That's their spiritual, a lot of spiritual um, spirituality is in those elements of having visions. So we have to really be careful. And I think churches need to also be careful about labeling
Oh
people.
yes. Oh yeah.
Yeah. So
Thanks so much.
um, Yeah. So what do you think? What are some of the practical steps we can do to reduce the stigma? I know you touched upon it a little bit, but what are some practical steps leaving today that we can take to our faith congregations to help with
So,
reducing some of the stigma?
so I think that, well, first of all, thank you for sharing those stories, those examples about cultural competence, because I think they're so important. And you're right, the labels really do follow people, and I've had, I've had patients who, have psychiatric diagnoses. And then when you ask about them, it's like, oh, well, somebody gave me that diagnosis when I was in one facility for something or the other. In
Right.
fact, in addiction medicine, it's like um, you're not supposed to give somebody a psychiatric diagnosis if they're only experiencing those symptoms within the context of drug use. And I think what often
Exactly.
happens is that people get labeled with, whether it's bipolar, whatever they were manifesting, that was a consequence of their using the drugs. It wasn't really that they had
Mhm.
that diagnosis, but then if if you're not careful, that diagnosis can just follow them and can really make an impact. So thank you for sharing that.
Yeah.
Yeah. So, again, in terms of reducing stigma, um, I think one, just raising awareness, having forums like the one we're having right now, where we come together, we learn from each other, we share resources, and churches can also sponsor programs like this, host programs like this, where they bring in mental health professionals, medical professionals to come and talk with members of their congregation, and then getting to know the resources around you, and normalizing these things. People who have had lived experiences with, whether it's mental illness or addiction,
Exactly.
can share their stories. But for them to feel
Yeah.
comfortable, again, we have to reduce the stigma. So we have to create those safe spaces and a safe
That's
environment.
great. Yeah. So one of the great things Center of Addiction and Faith are doing, we're training peer recovery coaches to go
Mhm,
out into the community who
mhm,
have lived experience, who the
mhm,
person can relate to, who's struggling, and that goes, with addiction. But they're also
mhm,
peer recovery specialists
mhm,
for folks with mental health challenges. So
mhm,
I think when we make it more of a community effort and
mhm,
not
mhm.
like here you are suffering in isolation,
Exactly.
which just as you know, repeats the cycle of
Mhm.
shame, guilt, and all that other stuff. But when you can say that, there's somebody else that's gone through this
Yes,
who can help me,
exactly.
that's where the hope
Oh dear, I'm losing the audio.
gone
Michelle,
So
you're
Michelle,
frozen.
we're
through
losing your
that
audio.
too.
Michelle.
So I just wanted to give a plug out to
So Michelle, you're breaking out. Can you hear us? Can you hear me?
CAF for taking the initiative on support services through the peer program.
Okay. So Michelle, thank you so much,
Am
but
I
you were
frozen?
breaking out.
Okay.
You were breaking out, so we didn't hear most of what you said.
Yeah, think we've lost you, Michelle, but Dr. Simoyan and I will try to jump in where she left off. One thing I really appreciated that you dove into was around that dichotomy that sometimes comes up between faith and science. It reminded me specifically of a passage from Ben Sirah, which is a Hebraic text from the 2nd century before Christ. And it just said, honor the physician with due honor to them, according to your need for them, for the Lord created them. For healing comes from the Most High, and he will receive a gift from the King. So there in one of these, important texts was
Mhm.
this idea that God created the physician and gave us these gifts.
Mhm.
So when you're engaging with a pastor or a religious leader who has a tension there and isn't sure and wants to maybe over spiritualize things or compartmentalize, in which these things are completely divided,
Mhm.
how do you engage that conversation? How do you lead people along as both a person of deep faith and scientific training?
Well, I think it's just a matter of, well, one, it's important to listen to people and try and understand where they're coming from, and why they think the way they do, why they believe what they believe. And then since we're talking about spiritual leaders, uh, showing them, for example, from the Bible, like we talked about examples. Just because they didn't, you remember the Bible wasn't written in English to start with, and they also didn't have everything we have now, but they didn't have the same language, they didn't have the same technology, they didn't have the same medication, they didn't have the scientific knowledge. But there were clear instances where people were depressed, where people were anxious. So these problems have been around from the beginning of time. They're nothing new. But now the same God who gave us knowledge to be able to treat cancer, to be able to eradicate certain infectious diseases, is the same God who helps us with mental illness as well, who can help us with mental illness. He's the one that gave us the knowledge, right? He's the one that gave us the knowledge to address these things. And I think it's just trying to help people understand that mental illness is an actual illness. You know, it's not, there are people who believe that it's all spiritual. It's all spiritual, you know, but then what happens when you pray and pray and pray and pray and pray and the problem doesn't go away? You know, how many people have cancer and say, I'm just going to pray and let it go? I mean, and there are people like that, you know, but generally people are more accepting of, you know, when you go get medical care for physical illnesses. So I think it's, again, trying to help people to understand the mental illnesses and addiction are diseases of the brain. They're diseases of the brain and they can be treated, you know. So we don't tell our diabetic patients to stop taking their insulin or metformin. You know, there's no stigma attached to having to be on insulin or having to be on medication for hypertension. So how do we get from here from where we are right now to where people understand that, you know, mental illness is an illness like any other illness and it needs to be treated? I think it's with education, raising awareness, and just trying to meet people where they are, but trying to educate them and help them understand that, you know, that that mental illness has been misunderstood. And now that we know better, we should do better.
Yeah,
And
that's right.
think we've
Dr.
got Michele
Simoyan.
back.
Hi, everybody. Apologize for that. I am in the mountains. So I thank you, Tim, for taking over for a brief minute. If I go back out, please, you know what to do, Tim. So Dr. Simoyan, we just want to thank you so much for your conversation with us today. And we celebrate the fact that not only are you a brilliant scientist and physician, but you are also a talented writer, singer, musician. So I want you to tell us a little bit how you incorporate your commitment to transform education and healthcare through integrating arts and sciences, and how can faith-based communities help with implementing these methods as well?
Thank you so much. So for the longest time, again, talk about dichotomy. I felt like I really struggled to incorporate, you know, my various interests into my work, and I really, really wanted to. So at some point, I was able to start incorporating music and I realized that I can't technically do music therapy without being, I can't call anything I do music therapy without being trained in music therapy. But there are other ways I could incorporate music into my work. So I started having when I would have group sessions with teenagers at the facility where I used to work, I would just incorporate music. I would talk to them about the brain, about the developing brain, and how as adolescents they were, you know, their prefrontal cortex was still developing, and we would, you know, talk about drugs and all of that. And then we would end with music, end with a song. I would bring my ukulele and sing and play. And sometimes one of them was musical, or there was this one girl who had composed a song. She had a ukulele that she didn't want to bring with her to treatment, and her mother encouraged her to bring it. And she had composed this very moving song. So she sang and played, and it was just so moving, you know, brought people to tears. So I started doing that. And the patients really, really enjoyed it. So that's one way. I've also I'm also a writer, like, you know, so I've been able to combine my interest in writing and photography, and started publishing photo books. So the ones that would probably be of most interest to this audience would be my the devotional book, which is based on daily reflections from the book of Proverbs, and that was just published towards the end of last year. but it's my goal was to like, I really believe that there's different ways of learning, and we all know that, but we should try. That's why information should be presented in a way that it will appeal to different people, different styles of learning. So some people are more visual. So some people will see a picture and that will help them to remember the message better. And other people just do better with words. So I used my photography, but tried to use pictures that were that would help to reinforce the messages. And so, for example, the very last reflection proverb is from Proverbs 31, and you know, the Proverbs 31 woman and all that. And I had a picture of a female lion, and you know, the female lion representing strength and dignity and all that. And it was only after I'd already published the book that I realized that actually female lions actually do most of the hunting. So I thought, okay, that was a good choice. I didn't even realize that at the time. Yeah. And then the other book that I think will be of interest is a workbook, Transformation and Recovery Lessons from the Butterfly. So it's just a small workbook, was published earlier this year, where I've gone through the stages of change, you know, pre-contemplation, when a person hasn't really decided that they have a problem; contemplation, when they've realized that their addiction or their behavior, whatever it is a problem, and they're thinking about changing, you know, and then preparation, action, and maintenance. And so I went through those stages and compared them with the stages of the butterfly's life cycle, you know, transformation and all that. And then it includes case studies, brief case studies, and questions for reflection. So I think it's something that people might want to use in group settings or with individuals, for people who work with patients, or even just.
So I think, sorry to cut you off. We have some questions, Dr. Simoyan, from the audience. And I know people will be grateful that we have the link to your books in the chat. So we can definitely have them check on those links or click on those links. But I just wanted to get a couple questions are coming in. So I have a question from a guest. What is the difference between PTSD and CPTSD? Can you give us some insight on that?
So, okay, so I'm not an expert on this, I have to say, but PTSD is post-traumatic stress syndrome, and then post-traumatic stress disorder, and CPTSD is complex post-traumatic stress disorder. So it's pretty much it's PTSD, but just a complicated form of PTSD. And unfortunately, a lot of people are suffering from that. And unfortunately, a lot of people have actually experienced abuse in religious settings, which is a whole other topic for another day, that's contributed to what they're experiencing now, which can, you know, maybe described as, you know, complex post-traumatic stress disorder. So in the past, we used to think about PTSD. I was just going to say that.
No, I was just saying.
We used to think about it.
Finish, and then I'll.
People with, you know, people who have gone to Vietnam, you know, war veterans and all of that. But we're realizing more and more that that it's not just that. A lot of people have experienced complex trauma from their childhoods, either in their homes or, you know, sometimes in religious settings or whatever. And it's becoming more recognized now, and it really needs to be addressed.
Yeah.
Sorry, go on.
Absolutely, and especially as it relates to addiction and substance abuse, we know that there's a direct correlation between the ACEs report. If anybody's not familiar, it's the Adverse Childhood Experience Scale. And you can take that from a scale of 1 to 10 to find out, you know, how complex your trauma is. So PTSD, like you said, can happen one instant. It could be one traumatic event. It could be a series or a lifetime of traumatic events. And complex PTSD is like you said, more intricate and more debilitating to many people. I had it. One of my professors said, you know, throughout life, you have little traumas, right? You'll have like these little traumas, and then you'll have one major trauma, which can send you over the edge. So that's sort of how I like to look at it. But definitely it impacts the African-American communities, Latino communities, different communities, all communities. So I think it's now getting the recognition it deserves as it relates to how we deal with these different challenges. Okay, got one more. Let's see. Hang on. So, okay, so I've got a question for Madeline. So she says, aren't these examples the ways and words of the society's normal language? Technically, suicide was deemed a crime. How do we show and teach that being an alcoholic addict is the same as having diabetes or cancer? And I think you've done a good job explaining that, but could you answer Madeline, Dr. Simoyan?
About, so sorry, what was the first part again? The language, I think education, raising
Yeah,
awareness, and just trying to raise awareness and increase people's sensitivity to these things. It's going to take a long time, and you're right, these are the, this is the language that's just become, the norm, but we won't undo it unless we make a deliberate effort. So and it starts by, having conversations like the one we're having right now.
yeah. Yep. And I have another question from Stanley. Stanley wants to know, if mental illness is a disease, how do we apply spirituality in curing diseases, particularly in the Western world where diseases only and mostly are treated medically?
Oh, so good question, but I don't agree that diseases are treated only medically. Yeah, I think you absolutely have to consider the spiritual aspect, especially in addiction medicine. And that's why I'm grateful that I'm actually in this field where it's actually recognized that spirituality is an important part of a part of the healing process. So I think it's a mistake. Again, it's dichotomy, physical,
Yeah.
spiritual, it's, we have to think about everything. So I don't there are actually people who have mental illness who don't need medication. Maybe all they need is therapy and spiritual care, so not everybody needs medication, but a lot of people do need medication. A lot of people with there are people who will tell you that they just stopped drinking alcohol cold turkey. They just had a religious experience and then they stopped drinking. But how many people can say that? And how, and
Right.
I'm yet to meet anybody with opioid use disorder that said that they just stopped without
Yeah.
any help, So again, God has given us this knowledge. Let's use it, But again, the fact that we're using medications doesn't mean that we don't have faith or that we're not considering the spiritual aspects of care. I really believe in having a holistic approach where we're looking at the whole person, body, soul, and spirit. We're looking at the whole person medically. We're looking at, their medical needs, their physical needs, their mental health needs, their
And
oral health needs,
actually,
everything.
right.
Yes.
Actually, now, in fact, there has been a big push to merge the medical community with the behavioral health community.
Mm-hmm.
So now when a person goes to their doctor, they're being asked questions about, are
Oh
you
yeah.
experiencing depression,
Oh yes.
anxiety?
Yes. Oh yes.
What's your sleeping been like? So there's definitely been a push towards the medical community to be more open and affirming to folks
Oh
who are
yes.
struggling. So
Oh
I've
yes.
got a couple other questions. You ready?
Yes.
So when will this, okay, so Madeline, we talked a little bit about, the effects of mental health in the communities. I want to just give a little bit of more background on BIPOC statistics. And so I did a little research, and this is Madeline. I know you wanted some more statistics and how this impacts the BIPOC community. So I just wanted to share this. So for alcohol use disorder, people with mental illness mental challenges struggle with substance use disorder more than anybody else in the population. And so in the United States of America, Caucasians or whites rank number one. African American have the second highest rates of drug use, and then Hispanics have the third highest rates of drug use. And what you talked about recently with the opioid crisis, there's been a jump since 2020 between African American deaths and people from other backgrounds. So since 2020, opioid related deaths were 24% between white or European populations. It jumped to 44% among Blacks, and then 39% among India and Alaska natives. And then currently, Black individuals have the highest rates of opioid and synthetic opioid related overdose fatalities compared to other racial ethnic groups. So this is really important for us to realize there's a lot of work that still needs to be done out there in bringing these services into people of diverse backgrounds. We haven't really talked a lot about the American Indians or Alaska Natives, but they've had the second highest rate of opioid overdoses and the third highest rate of overdose deaths across all racial ethnic groups. So we definitely, I've got my notes here. If you want me to send my research in the chat, I can be happy to do that, or I can give you my email address so we can keep this conversation going. This is just one conversation of many that we're prepared to have at the Center of Addiction and Faith. I want to thank Dr. Simoyan for being a part of our talk today. Tim, Ed, Katie, who works behind the scenes. I definitely thank you, Katie, for all that you do. We don't see you, but you're doing all of the stuff behind the scenes. And Dr. Simoyan, would you like to add anything else? I think we're going to pop over to the others.
Okay, so I wanted to mention that there's a resource by a gentleman named Dr. Matthew Stanford. It's a book titled Madness and Grace, a practical guide for pastoral care and serious mental illness. So I haven't read the book, but it looks like it's a good resource, even though I'm not crazy about the title, but yes. And may I make a closing statement? I wanted to sing,
Sure.
but the audio wasn't working. So I want to leave you with a message instead, if you just bear with me. So the virgin birth, the resurrection, life after death. Some things require faith in the supernatural. For everything else, God gave us brains. Let's keep them healthy. Thank you.
Thank you, Dr. Simoyan. Thank you so much. So we are going to continue the discussion for those of you who would like to stay on. Do we have time for a couple more questions?
Yes, we do actually.
Okay, let me see. Katie, let me see.
Well, I have a comment. I don't know if it's a question, but
Yeah.
it'd be worth mentioning. I just think about having been a pastor for 28 years and learning about what's going on in the pews. It seems to me there's a whole lot of people silently suffering.
Mm-hmm.
And that because of the stigma and because of the shame that's involved around admitting that you have a mental health issue. I mean, you can get cancer and that's one thing, but if you suffer depression, that's really something you don't want people to know about. And I just think our congregations are filled with people who are afraid to say anything. And it seems to me those who have found healing have the opportunity to share the healing that they've discovered so that others might have the courage to step up. I know the church, one of the churches I've served had a mental health awareness team. And what they would do is every year have a mental health awareness worship service where they had people recovering from different mental health issues share that. And inevitably other people would come out of the woodwork and say, you know, I'm having this struggle too. And so it's powerful when people who have found healing share that healing with others.
Exactly.
Yeah.
Thank you.
And I know that part of the problem in order to admit that you have an issue is that you have to admit weakness. And
Yes.
Dr. Sizer, a Black man from Louisiana, who is a member of our board, has said in his churches with the faith leaders there, with the Black faith leaders, the challenge for them is admitting weakness, because the faith tradition, you're supposed to be strong in your faith, and you're supposed to be, you know, things have to be going well for you. And so that's the huge hurdle that has to be overcome in order for people to say, I'm hurting.
Yes.
Because even the pastors are hurting and they can't say that because the pastor has to be really strong.
Exactly. There's a lot of, that's so true. Thank you. It's, I think there's a lot of toxic positivity. Yeah, just have faith. You know, everything's going, you know, hunky-dory, everything's fine, and things are terrible. I mean, yeah, you're right. And then especially the pastor, because, oh, you're the pastor. You're supposed to be the closest to God. So how can you be having struggles? How can you be having, but we're all human. So we need to just humanize these things and humanize our leaders as well, and let it be okay to say, you know, I'm not okay and I need help.
Yep.
Thank you for sharing that.
Yeah, I know that.
So go ahead, Ed.
Yeah, I just know that in scriptures, the people that get help from Jesus are the people that are willing to say, I need help. And they're
Exactly.
desperate to get it. They tried everything else. And
Exactly.
until you can say, I need help, your chances of getting help. So for those who are silently suffering, tell somebody you're hurting. That's the first step. And when you do that, help will follow.
Yeah.
So thank you to all of you for being here today and for being a part of this presentation. A couple of announcements. Again, thanks to Dr. Simoyan and Michele for your leadership.
Thank you.
Tim, as always, well done. Tim's book is Addiction Nation. There's a link in the, hopefully a link in the chat page where you can get a copy of that. I recommend using Tim's book and his accompanying study guide in your faith community. It's a great way to introduce the topic to your people. Because he covers a whole broad spectrum of issues that come out of the issue of addiction in America, because we're all suffering from it in one way or another. We have a great conference coming up in October. We're bringing together really, really great speakers to talk about addiction and faith and how faith communities can do a better job of helping folks who are struggling. That conference is October 5 through 7. You can go to addictionandfaithconference.com and get all the information and sign up. This webinar today is recorded and it will be available on our smartphone app and on our website and on our YouTube channel. So be watching for that in case you weren't able to get the whole thing, or else you want to share it with someone, you'll be able to do that. Speaking of our app, and Michele mentioned this, our app has a ton of information. We just surpassed 1,000 downloads from our phone app. It is filled with tools for addiction ministry. It's got even a really powerful help finder app in it. So if you're a pastor or a faith leader and you're looking to help someone find resources, this help finder will help you dial in exactly what resources are in your community that would be useful to a particular person that you're helping. Go to your app store and look for Center of Addiction and Faith, and you'll find a free app with tons of resources on it. And we have so much more we want to offer as the Center of Addiction and Faith. We're emerging from this COVID pandemic, and whatever mental health, that's pretty good. Mental health issues and addiction issues that were out there are far worse now, in case you didn't know that already. There's so much we could be doing to help people, and we need to be doing those things. So we're building this ministry to equip faith communities, and we need your help. So if you appreciate this work, if you think it matters, if you think it's important, please consider making a one-time generous gift or an ongoing sustaining gift. There's a PayPal link in the chat page where you can get information on how to support our ministry. So those who would like to join for a conversation following the link, copy and paste into your browser the link that's in your meeting, in your chat page. It's under follow-up meeting. And you can click that link, and maybe that would even open a separate page for you now. So once you leave this meeting, you can join that meeting, and we'll have a more in-depth discussion and allowing other folks to chime in. So thank you all. Thanks again, Dr. Simoyan, Michele, Tim. Thank you for being here today. May God bless you. And I hope to see you in the Zoom meeting.
I'll see you all in the next Zoom room. Thank you, Dr. Simoyan, everybody.
Thank you, everyone. Thank you so much. It's been my pleasure.